Why back this recommendation from the IATF? How confident are you that Filipinos can now manage and police their own COVID risks?
Well, a couple of weeks ago, we came out with our Father Nick and I came out with a press release, saying that I think we should move forward. Filipinos are learning to live really with COVID. We can see that very clearly. Booster uptake, unfortunately, is not where we want it to be. I think it's something that we still have to continue to push. But then again, we have to respect the freedom of our people, to freedom of choice. No matter what we try to do, if they feel that Omicron is mild and they're willing to take that risk. I think we have to have a change of mindset. Let's realize that this pandemic is really moving already to what we think will be similar to the flu, maybe a little bit more challenging than the flu, but people have learned to live with COVID-19, no? And I think we have to accept that fact. Wearing of mask outdoor, to me, is really, optional, no? Wearing of mask indoor is definitely a must, and that is something that we should still continue, no? But let us trust that many of our people who go outdoor should enjoy the fresh air, no? And make the decision for themselves. And you can see that in areas that are still crowded outdoor, people will continue to wear face masks, especially the seniors, no? But let us give them the choice, no? That's, to me, very important. As other countries have removed mask mandate outdoors, I think the Philippines should continue. If we really want to bring up the level of tourism and tourists to come to this country, definitely they should be allowed to remove the mask outdoor.
Okay, sir. So that brings me to my next question. No? Apart from the hassles, that this would ease, is there a direct link to increased businesses, especially for MSMEs? A better economic figures, perhaps by just not mask wearing, or is there something that we can expect that once this mandate is done, that there will be better business opportunities?
I don't think there will be any difference whether you wear a mask or use a mask in terms of economic activity. Definitely, the opening of schools will generate more economic activity. But what we are doing with giving the optional wearing of mask is allowing people to practice their freedom. No, if they feel that they are at lesser risk and the place is not crowded, then why not allow them to remove the mask? But remember, the other thing is, how do you implement mandatory outdoor use of masks? No, are we going to fine them? Are we going to ticket them? Are we going to, what is the penalty for that? No, so it's very hard to implement. No, something like that. It's almost impossible. Are we going to jail them? So if you can't really implement something on a mandate level, it's going to be difficult. Unlike indoor, if they don't wear the mask, they can't enter. But how do you prevent people from entering an outdoor space? No? It's impossible. So if you can't implement it, why will you do it? I said all just for show. That's why I was telling. I mean, we have my friends in the advisory council of experts, our doctors. Everybody is definitely for outdoor wearing of masks, but I've explained to them it's so hard to implement, no? If it's hard to implement and police, then you will never be able to, implement it that well. So let's trust the judgment of our people. I think through these years they've learned to live with COVID. So. I understand the doctors and I take their advice in most of the cases, but and especially for indoors, definitely that is something that we should keep.
Now, Joey, do we have enough mitigation strategies here in place to allow for an optional mask mandate? I mean, you yourself mentioned earlier that booster take-up remains a challenge. So what then should be the direction here, the policy that government should be working towards in order to at least offset the possibility of an increase once, of course, we let go of that mask mandate, especially outdoors?
Well, together with our Advisory Council of Experts, we've really been pushing really hard in promoting boosters. No? I mean, we have launched campaigns on Isa Pa and all of that. And we have conducted a lot of these town hall sessions and asked our experts to really explain why the importance of boosters. But it's still very challenging. And the way I look at it is that if we can't impose, restrictions on mobility in entering restaurants, etc., and that is detrimental to the economy, we should just continue to, promote it. But my point is that at a certain point in time, it's really the decision of these people to be responsible enough. If they have not been infected, so they will be definitely having a waning immunity if they don't take their succeeding boosters. We just have to continue to push, and that I fully support.
Sir, as sitting on the Private Sector Advisory Council of the President now, what is your advice on the next steps for vaccination? Are we still going to be spending budget for boosters that you mentioned are not being taken up? Are you going to be pushing for the private sector to make this mandatory in some cases? What's the game plan now for vaccines?
And more to that also, you have the health department saying that time will come that vaccines will no longer be free.
Definitely. First of all, when talking to our experts in the advisory council, which has been advising us in the private sector, of course, booster is something that we've been discussing. And I've explained to them that the bivalent vaccines may be coming in towards the end of the year or early next year, and what their position is for this. And I guess very clearly, especially for the elderly, those 60 years and above, that is something that should be considered. And hopefully by then, the government will be able to purchase maybe not, will be maybe purchase the right quantity now. But the private sector's participation here, I think we are open to the idea of also supporting our employees, those who are qualified to take these new booster shots, the bivalent booster shots. But we're still waiting for advice from the pharmaceutical companies as to whether they will file for certificate of product registration, which means that these vaccines can be sold in the drugstores or in the hospitals.
Okay.
So that changes the game. In other words, we can now buy directly from the drugstores or the hospital. So it all depends. And I think the intention of the Marcos administration is they may extend the state of public health emergency till the end of the year, which may be good because then it will allow more time for these companies to apply for CPRs. Right now, the vaccines are under emergency use authority, and the government has to guarantee that in case something happens to the people taking the vaccines, the government is responsible. But to me, that the pharmaceutical companies should be responsible for that. But for that to happen, pharmaceutical companies will have to apply for CPRs.